welcome friends once again to our NPTEL MOOC module on health economics. This is our second lecture of the 11th week on explaining the data in healthcare. So, hence we are focusing on sources and indicators. Here this is in continuation to the previous lecture on observational data from micro settings. At the very desegregated level, we have survey data, both qualitative and quantitative. So, this is what we discussed previously. Right now, our focus is on administrative data. We will focus on important sources, macro dimensions and indicators, their challenges and limitations. Coming to the understanding of the administrative data, although health economics is mostly about dealing with microeconomic data sources that are obtained from observational studies, administrative data acts as a link between both micro and macro data sources, as this provides both micro level information, for example clinical records, and also macro level information, for example birth or death rate at the state or country level. However, unlike the data obtained from observational studies, administrative data are not directly usable for research, as they are designed for administrative decisions and policy making. Usually, the administrative data has hardly any options left for deriving what I call research questions to validate or to reject. Since these are government records and this has to be considered as the parameter to compare your findings from the ground. So, the importance of administrative data should be discussed. Administrative data provide useful information to health economists. So, for example, insurance claim data, birth and death registration data, etc. These data are less prone in comparison to observational studies or micro data to both differential non-responses and item non-response. So, when I mean differential non-responses, that means it has a significant difference in non-responses, mostly due to death, institutionalization, emigration, refusal, etc. Coming to item non-response, refers to refusal or answering with don't know in the questionnaire. These issues are mostly found in micro or observational studies, along with other measurement error that need to be taken care of. It has broad coverage, comparability, policy orientations, linkages with observational studies, predictive analysis, etc. So far as the broad coverage is concerned, it is often linked to another administrative data set using unique identifiers, which makes them comparable. Hence, comparability is important as administrative data also provide information aggregates. It allows comparison between different states and countries possible. This is based on different indicators that share common methods of computations. Okay. Coming to policy representation, it has a leveraging aspects such as leveraging macro health data, enables evidence based decision making and targeted public health initiatives, improving overall population health. This is a strong linkage with the observational studies, because many of the macro aggregates or the administrative aggregates are taken from the micro foundations or micro surveys as well. Many studies now link the administrative data with the survey data, which provides micro level information. This raises potential of both data sets. About predictive analysis, by identifying health trends and patterns, macro health data adds in predicting and preventing potential health threats. For examples of Indian health related administrative data sources, we usually refer to the sample registration system, that is SRS, that is long back developed and also consistently giving different follow on years and its figures. In India, there was a need for macro data on population for planning development programs. These records are needed. Hence, the Office of the Registrar General of India initiated SRS in the year 1964-65 on a pilot basis, and from 1969-70 it was operational on a full scale. This provides information on birth and death rates, infant and maternal mortality rates and ratio, etc. The link is given here. It's from the census website. It's part of the census as well. It's rather the specifically it is called sample registration system. National health accounts, another administrative data, is highly referred for international comparison purposes as well. National health accounts, its link is given here. You can download the complete report. Let me also open a bit on this, open at this moment, then I will guide you. So, here it is. So, different years, the latest available one we are just opening in front of you. It is considered to be a standard document to start with a research. It has 100 pages, and this is in fact the latest in record of the Government of India on health issues so far as the administrative data on healthcare is concerned. And in order to have strongest foundation of your research, I will refer this document to start with. So, there are abbreviation given, and I think contents we have already shown to you, and these are highly useful. I will just straightway go to the contents again. How relevant this for your research is important. Okay. So, here it is. Yes, the table. You can just see key health financing indicator, expenditure estimates by national health accounts classification, etc. You might have read from the newspaper that our out of pocket expenditure is very high. It is still, by all means, government whatever the step have taken, still it is around 64%, more than 64%. So, that means the people incur huge cost related to healthcare, and they are expected to be impoverished due to healthcare expenditure. These information you can straightway get from this source. All right. And you can also check with different state level information as well. This gives information about capital formation both at primary level, secondary level and tertiary care expenditures are also given, and you will get information about other issues such as broad health financing and macroeconomic indicator. Even the out of pocket expenditure in PPP terms are also given. So, I will suggest you to follow this, will help you a lot. Then coming to national health profile, yes, this is from the Ministry of Health and Family Welfare record, and this also gives you more information about the demographic indicators, socio-economic indicators, health status, health finance, human resource, etc. And another important aspect is health infrastructure. Issues are also available. To continue, we need to also check Central Bureau of Health Intelligence, the health sector reform option database, etc. This website provides information about good practices and innovations in health services management carried out by state governments, development partners and NGOs. So, further we will also suggest you to follow some other institutional database, including the time series data from EPW, Economic and Political Weekly Research Foundation, time series data. It has different components of health information. Also, we will suggest you to refer to the SDG India Index, part of the Niti Aayog, and I think you can just click on this. I will show you some interesting aspects. You will find the ranking of the states This was started from the previous episodes, and the baseline index was also given. If you see, 2018 was the beginning period. So, and you can have comparison with different years till the 20. And interestingly, it gives information about which are the front runner states, which are the performer states, okay, which are the achiever, front runner, performer, and aspirant states based on the color combinations. It has a component on good health and well-being, and the ranking of the states can easily be understood from this single website. And to foster your base for taking up a research, I will surely suggest you to refer this. Gives you a selection of the state if you want to focus on a fields observation from a state or from a district, but at least the state indicators are clearly available here. You can filter the state and cite this website. For example, so far as good health and well-being is concerned, as per the latest figure, so states are here. You can just have a look, and from the figure itself, performer districts are in yellow, whereas the front runner districts are in states. This is on state level information. Front runner states are in green color. So now your focus would have been on the performer states such as Uttar Pradesh, Madhya Pradesh, Chhattisgarh, in some part of northeast India. And one good thing is that we have no single district which is in the category of aspirant one. Hence, you can similarly other indicators like your first, that is eradicating poverty, then this is on hunger, this is well-being which you have said, this is on quality education, this is on gender equality, this is water. For all indicators you will have good information to start your research work. This is one. Then last one we need to refer here is your the Digital India Initiative, Government of India portal, where it gives information about human development index and its component by states, and it will also give you very strong backup for your research so far as administrative data is concerned and for comparison. Few examples of international health related administrative data sources are mentioned here. For India, I mean, WHO is considered to be the best for comparison across the globe with India. So, hence we have given the link here. Another one is called OECD data set for comparison. Even the EPWRF also gives a strong backup for time series analysis for international comparison as well, but very limited information for comparison. Another interesting data sources is called Global Burden of Disease, GBD. It is by IHME. So, the link is given here. I will suggest you to cross check if you are working on, focus on this if you are working on DGS. Similarly, the World Bank site, projects and their, aggregate data sets are important. Human Development Index used to be referred. Last but not the least one is Statista. It's usually a paid one, but the macro aggregates are considered to be very good, and it gives aggregate information for comparison. I am not going to the detail, the links are here for your reference. Few examples of other administrative data sources are also mentioned here, like pharmaceutical company and its database like CMI ProS IQ. Usually these are paid, you can follow it. Pharmaceutical companies maintain databases for drug research, clinical trials, and pharmacovigilance, etc. So, ProS IQ is also referred. Hospital information system, HIS, MHIS, etc. Private hospital use HIS for managing patient data, appointments, billing, and inventory management. Digital health platform such as electronic media records, health information apps, telemedicine provides for the data sets as well. For academic and research institutions, they are also providing macro or the administrative data sources as well. University and research institutions conduct different studies and surveys. They also pool those surveys to generate macro health data. Indicators derived from administrative database are like public expenditure, mortality, morbidity, fertility rates by gender, life expectancy at birth, age dependency ratio, disease burden, which include health status, health risk, etc., including maternal and paternal nutrition conditions. Infrastructure includes health resources, health equipment, like performance of facilities, number of beds in Indian hospitals. Service delivery indicators include healthcare use, efficiency, assessing quality and performance. Some economic indicators are also relevant while understanding these administrative data sets, such as health related expenditure, like as I mentioned, out of pocket expenditure, its ratio to overall expenditure of the economy, etc. There are also challenges involved in administrative data collection, such as accessibility issue. It is also costly affair, and interoperability and data integration is also a concern. Integrating data, it has challenges related to infrastructure and resources. Inadequate technological infrastructure and limited resources hinder efficient and comprehensive data collection processes. Last to emphasize here as well is on ethical and regulatory consideration. Compliance with ethical standards, data protection laws, and research regulations complicate access to health data for research analysis. So, I think these are all. Let us summarize what we said. Administrative data sources are a vital source of information for any health economist, as they contain both micro and macro data that enhance the reliability and accuracy of analysis. Harnessing diverse data sources for effective utilization is necessary for information decision and advancing healthcare innovation. However, their accessibility concerns many researchers, especially those with low financial support. Okay. And addressing this issue is crucial for fostering collaboration, innovation, and policy development in healthcare sector. This is because the data assists us in understanding health trends, assessing population health needs, monitoring health policy effectiveness, etc. So, whatever we have done so far, explained especially in this week in the first two lectures on the observational data through surveys and the administrative data from pooling, collating different administrative units and their observations at a fairly aggregate level. So, what we have thought of for the next lecture is on explaining econometric modeling in health economics and some estimation methods, which are largely used by health economists. I think at this moment you can refer to our chapter, our module of this for further clarifications. So, that is all. Hope to see you in our next lecture. With this, I must say thank you.